All right, so we're diving into something a lot of you have been asking about, and that's migraine relief. Specifically, those at-home remedies that might help you manage symptoms or even prevent those migraines from taking over your day.
Yeah, it seems like everyone's looking for those little things they can do themselves, right?
Yeah.
Especially when you don't want to always rely on medication.
Exactly. And lucky for us, we found this really in-depth article from Medical News today that breaks down a ton of these natural strategies. So we're going to go through all that good stuff today.
Awesome. And just to make sure we're all on the same page, it's important to remember that migraine isn't just a bad headache, right?
Right.
We're talking about like a full-on neurological event, intense throbbing pain, usually on one side of your head, but it's the extra stuff that really makes it a migraine. The visual disturbances, the crazy sensitivity to light and sounds and smells.
Yeah, and let's not forget the nausea. Not fun.
Oh yeah, that's a big one. And the article's clear about this. While medication definitely has its place, we're going to zero in on what you can do at home, naturally, to find some relief, maybe even stop those migraines in their tracks.
Love it. So first up, acupressure. What's the deal with that?
Well, it comes from traditional medicine, the idea that putting pressure on certain spots on your body can actually help ease pain. The article specifically mentions this spot called the LI4 point.
Okay, so where is that exactly?
It's right between like the base of your thumb and your index finger on the back of your hand.
Hmm.
That fleshy area.
Got it. And what do you do? Just push on it?
Yeah, pretty much. The article says to use your thumb and index finger from your other hand and apply firm circular pressure. Do that for like 2 or 3 minutes.
Interesting. So is there any proof this actually works?
Well, there's a 2017 study mentioned that looked at people with chronic migraine with aura. They used acupressure along with their regular meds. Well, the acupressure seemed to help with nausea, but it didn't actually reduce the headache pain itself. And their quality of life didn't really change either.
Huh. So maybe it helps with specific symptoms, but not the whole migraine shebang?
Seems like it.
Makes sense. Okay, so besides pressure points, what about what we're eating? This whole idea of dietary triggers always comes up.
Oh, yeah, that's a biggie. And the article lays out some of the usual suspects that people often link to migraine attacks.
Hit me with the list.
So we've got processed meats, alcohol, chocolate.
No, not chocolate.
Sorry to be the bearer of bad news. And caffeine, too, can be a trigger for some.
Oh, that's interesting because later on the article talks about caffeine as a potential reliever, too. So confusing.
It is a bit of a head-scratcher, right?
Mm.
We'll definitely come back to that caffeine conundrum later. But the main takeaway here is that dietary triggers are super individual. What sets off a migraine for one person might be totally fine for someone else.
So how do you figure out your personal triggers?
The article suggests keeping a symptom diary. You basically write down what you're eating and drinking and when you get migraines. Then you look for patterns.
Oh, like becoming a food detective for your own head.
Exactly. That's a great way to put it.
All right, so what else does the article suggest for at-home relief?
Well, they talk about essential oils. That's been getting a lot of attention lately.
It has. What's the thinking there?
The idea is that inhaling certain essential oils might help with stress and anxiety.
Okay, and that makes sense because stress is a huge migraine trigger.
It is. But the article goes a bit further, suggesting that some oils might also help ease general headaches. And they even reference a 2021 review that looked at lavender, peppermint, chamomile, and basil.
And those were helpful.
The review suggests they contain compounds that could potentially help with migraine symptoms. And get this, there's a 2020 study mentioned where people applied basil oil topically.
Topically, so like rubbing it on their skin?
Yep, and it actually seemed to reduce both the intensity and the frequency of their migraines.
Wow. Okay, so that's pretty promising. But I'm guessing there's a but coming.
Well, the article does stress that we need more research on essential oils. We need to figure out which ones work best and how to use them most effectively.
Fair enough. Are there any safety concerns we should be aware of?
Definitely. The article points out that some oils can be harmful to kids, people with asthma, and pregnant or breastfeeding women. So talking to your doctor before using them is a must.
Good advice. And what about how you actually use them?
Well, for inhalation, a diffuser seems to be the go-to. But if you're putting it on your skin, the article says you absolutely have to dilute it with a carrier oil first. And always do a patch test on a small area of skin to check for allergic reactions.
Makes sense. Anything else to keep in mind with essential oils?
Yeah, the article reminds us that the FDA doesn't regulate the purity or quality of essential oils. So it's on us to do our research and choose brands that are reputable.
Good point. So, moving on, What about ginger? I know it's great for nausea, but does it have any impact on migraine?
It seems so. The article mentions this 2021 review that looked at several clinical trials on ginger powder for migraine treatment.
And what did they find?
Pretty impressive results, actually. It was both safe and effective, and it significantly reduced pain within about 2 hours compared to the control groups. And of course, it helps with nausea and vomiting too, which we know are common migraine companions.
That's fantastic. But are there any downsides?
Well, the article does caution about potential side effects and interactions, especially for people taking blood thinners like warfarin. Ginger could increase their risk of bleeding, so another one to chat with your doctor about.
Got it. So let's shift gears a bit. We can't talk about migraines without addressing the stress factor.
Oh, absolutely. The American Migraine Foundation, as cited in the article, estimates that a whopping 70% of people with migraines say stress is a trigger.
That's huge. So managing stress is pretty crucial then.
It's essential. And it can be this vicious cycle, right? The pain of the migraine stresses you out, which can then trigger another migraine.
Ugh, it's like a migraine monster feeding on itself.
Exactly. So the article talks about finding healthy ways to de-stress. Journaling, exercise, meditation, those are all good ones.
What about things like taking a warm bath or listening to music?
Totally. And breathing exercises, joining stress management classes, whatever works for you to break that stress migraine link.
I love that. It's about finding what calms your mind and helps you relax.
Exactly. And the article then goes on to talk about yoga.
Yoga. I've heard it's good for stress, but can it actually help with migraines?
There's some encouraging evidence. The article points to a 2023 review that looked at yoga as a complementary therapy for migraine. It seemed to reduce the frequency, duration, and severity of migraines.
Whoa, that's pretty impressive.
It is. But the review authors did mention that the studies they analyzed had some limitations, so more research is needed.
Fair enough. But it's still a good sign.
Absolutely. And the article also highlights a 2022 review that found short-term yoga practice not only helped with migraine symptoms, but also reduced anxiety, depression, and stress.
Okay, so yoga seems like a win-win. It tackles the migraine itself and the underlying stress that can contribute to it.
Right on. And then the article moves on to biofeedback therapy. Have you heard of that?
I have, but I'm not totally sure what it is. Can you explain?
Sure. It's basically learning to control bodily functions that are normally automatic, like muscle tension, for example.
Okay, and how do you actually do that?
They use sensors on specific muscles, and these sensors are connected to a machine that shows you in real time how tense those muscles are.
So you can literally see how tense you are.
Exactly. It helps you become aware of tension you might not even realize you're holding. The article mentions sensors on the forehead, jawline, and those trapezius muscles in the shoulders.
Oh yeah, those are classic tension spots.
Totally.
Yeah.
And by getting that feedback, you can learn techniques to consciously relax those muscles.
Interesting. Okay, so now we have to circle back to caffeine. It seems like it has this dual role in migraine, friend or foe.
Right. It's confusing. The article acknowledges that for some, caffeine is a trigger, but for others, it can actually stop migraine symptoms or offer some relief after an attack.
So what's the deal with that?
It likely has to do with caffeine's vasoconstrictive properties. It basically narrows blood vessels in the brain, which some believe plays a part in migraine pain.
Okay, that makes sense. But then why is it also a trigger?
Well, the article points to a 2020 review that warned against overdoing it with caffeine. It could actually lead to more frequent migraines. And if you're a regular caffeine drinker, suddenly stopping can also be a trigger.
So it's like a balancing act.
Totally. The review authors suggested sticking to under 200 milligrams of caffeine per day if you have migraines. And if you do consume it regularly, try to keep your intake consistent.
Good advice. Okay, what about massage? I feel like that's a classic go-to for any kind of pain.
And for good reason. The article suggests that massaging your neck and shoulder muscles can relieve tension, ease migraine pain, and even reduce stress.
Triple win. Do you have to go to a professional or can you do it yourself?
The article mentions both. Seeing a massage therapist can be great, but they also share a DIY trick. You can use a tennis ball against a wall to target those shoulder and back muscles. It's super effective for releasing tension.
I love that. Simple and effective. Okay, what about magnesium? I know that's an important mineral for overall health.
It is, and the article highlights its potential role in migraine. It says a magnesium deficiency might actually trigger migraine aura, or those menstrual migraines.
Huh, interesting. So should you take a magnesium supplement?
There's some evidence to suggest it might help. A 2022 review found it could be beneficial, especially when combined with standard migraine meds. But of course, more research is needed, and talking to your doctor before starting any new supplement is always the best approach.
Agreed, especially if you have other health issues. All right, what about other vitamins? Do they play a role in migraine?
The article focuses on B vitamins, particularly B2.
And what's special about B2?
Well, it seems it might help reduce migraine frequency, duration, and severity. It probably has to do with its role in regulating neurotransmitters in the brain.
Okay, that makes sense.
Yeah, and the article mentions a 2021 review that found taking 400 milligrams of B2 daily for 3 months had a significant positive impact on migraines.
Wow, that's pretty specific.
It is. The article also talks about vitamin D. A 2018 study found that people with migraine who were deficient in vitamin D tended to have more migraine days.
Interesting. So getting enough of these vitamins could be helpful.
It seems so, though they do say that while B vitamins are water-soluble, meaning your body flushes out excess, it's still wise to talk to your doctor before taking any new supplements.
Definitely. Now let's talk about something I know a lot of people are curious about. Herbal supplements.
Oh yeah, lots of interest there. The article summarizes a 2020 review that looked at various herbal treatments for migraine. It seems curcumin, citron, and coriander might be good for prevention.
And what about when a migraine is already happening?
Chamomile and menthol might offer some relief in those cases.
Interesting. Were there any herbs that didn't fare so well?
The review found mixed results for feverfew and limited positive evidence for butterbur.
Got it. So mixed bag there.
Yeah, and the researchers actually highlighted a significant risk of bias in many of the studies they looked at, meaning we need more high-quality research to really determine how effective these herbal treatments are.
Okay, that's important to remember. Any other cautions about herbal supplements?
Definitely. Just like with essential oils, there can be risks. Chamomile, for example, might interact with blood thinners like warfarin. So, yet another reason to consult your doctor before trying any new herbal remedy.
Absolutely. Safety first. All right, let's shift gears to something super basic. Water.
Ah, yes, the elixir of life, and potentially a key player in migraine prevention. The American Migraine Foundation, as cited in the article, estimates that about 1/3 of people with migraines say dehydration is a trigger for them.
Wow, a third. That's a lot.
It is. So staying hydrated throughout the day is crucial. And even when a migraine hits, sipping water might help with nausea.
Such a simple thing, but so important.
Absolutely. And the article also emphasizes the importance of rest.
Yeah, when you have a migraine, sometimes all you want to do is lie down in a dark, quiet room.
Exactly. And for some, falling asleep can actually help relieve the pain.
But what about rest as a preventative measure?
The article points out that both too much and too little sleep can be triggers for some people. Most adults should aim for about 7 hours of sleep per night. And consistency is key. So try to stick to a regular sleep schedule.
Makes sense. So last but not least, the article talks about compresses, warm or cold. Which one's better?
The article says it depends on the person. Some find cool compresses soothing, others prefer warm. It can help reduce migraine pain either way.
But are there any instances where you shouldn't use compresses?
They do advise caution for people with circulatory problems, diabetes, or certain skin conditions. Extreme temperatures might not be a good idea in those cases.
Good point. Okay, so before we wrap up, the article also talks about knowing when to seek professional help.
Absolutely. If your migraines are happening more than a couple of times a month, or if they're so severe that they're interfering with your life, it's time to see a doctor.
And what can a doctor do?
Well, they can rule out any underlying medical conditions and advise on the best way to manage and treat your migraines.
Okay, that makes sense.
Yeah, and the article also highlights that migraine is often underdiagnosed, especially in certain communities. So if you're not getting the answers you need, don't hesitate to get a second opinion or see a headache specialist.
That's great advice. Okay, so as we wrap up this deep dive into natural migraine remedies, it's clear there's a whole arsenal of strategies to explore.
There really is. We covered acupressure, diet tweaks, essential oils, ginger, stress management, yoga, biofeedback, being mindful of caffeine.
Don't forget massage, magnesium, vitamins, herbal supplements, hydration, rest, and compresses.
Whew, that's quite a list. And the key takeaway is that everyone responds differently. What works for one person might not work for another.
Exactly. So finding what works best for you might take some trial and error.
Totally. And we can't stress enough the article's recommendation to talk to your doctor if migraines are a frequent or severe problem for you. And definitely, before trying any new remedy, especially supplements or essential oils, just to be safe.
Absolutely. They can help you create a personalized plan for managing your migraines.
Exactly. It's all about finding what works best for you with the guidance of a healthcare professional.
So, with all these different approaches in mind, what's one small change you might try in your own routine to see if it helps with your migraines?